My name is Elena Garcia and I am a registered nurse. I work at People's Community Clinic as a chronic disease care coordinator. Today I would like to show you our new building and walk you through our amazing spaces and talk a little bit about the services that we provide. So we moved recently to our new location at Camino La Costa. We have a bigger building and that has been really great. It's allowed us to form more wellness programs. So now we have a cutting edge kitchen, we have a nutritionist, we have this amazing room where we can provide education. We have Zumba classes, we have yoga classes. We also, during the summer, we had a free lunch program for kids around the community. We're a patient-centered medical home, and I think this building just really allows us to elaborate on the services that we provide. So the way the building was designed is to promote care teamwork and engage the patient. So one of the things is that the offices where we sit is an interdisciplinary team, so it has a provider, a nurse, a social worker, a unit clerk, and other areas of the care. So if there's any issue, we can easily just, interrupt real quickly and get the information that we need, and I think that helps in preventing delays of cares and improves the communication and the teamwork. As a chronic disease care coordinator, our job ranges from population health to individual care plans, working with the patients. So I come in the morning, I get a report that allows us to identify patients that are diabetic or hypertensive. And we also get quality measures such as like their A1C level, their food exam, their eye exam. So that way I'm more prepared when I meet the patient. I know these are the things that we need to work on. But also when I meet with the patient, I spend a lot of time hearing their story, seeing what's important to them, and building a plan with what they think is important to them, and then communicating that to the team, making referrals, whether they need clinical pharmacists, integrated behavioral health services. We also have a nutritionist, or we also refer them for further diabetes education. Every single day I am amazed at the people that we meet and the ways that we can help our community. One of my favorite stories is of a young woman with type 1 diabetes. She came in, she hadn't been in years to the clinic. She had very uncontrolled diabetes. And I met with her that day and I spent about 45 minutes just talking to her, letting her tell me what was going on in her life. And from that I was able to identify what was important to her and understand her better. I asked her how we can help her, and she told me that she could not afford the insulin, which is a huge issue with a type 1 diabetic. So we set her up with the patient assistance program. We also referred her to a behavioral health counselor to deal with some of the anxiety that she had from the unstable home situation. We sent her to the clinical pharmacist so that they could adjust her insulin doses. And within 3 months, she went from an A1C of 14 to less than 7. And that was amazing. And everything that we did collectively, all the integrated services, were what she needed. A huge part of it was education, and we gave her what she needed and she made the best out of it, and now she's a healthy, managed person with diabetes. I do feel over time, you meet these patients and you follow them for months, even years, and you get to see them go up and down in their life events. But ultimately it's so inspiring, especially when they're ready to make a change and you're there and it works out. It does feel like maybe we're saving lives, but in addition to that, we're improving their quality of life.